Hi guys, it's Tim here from Goulburn Physiotherapy Centre, and I'd just like to take a little bit of time today to have a chat with you about trigger point dry needling, which is a service available here at our clinic. Trigger point dry needling is a style or a way of treating tight connective tissue, tight muscles. So a trigger point itself is what you commonly think of as a knot. So it's a tight part of muscle tissue that we're looking to treat. Now these tight parts of the muscle tissue, the trigger point, they can be responsible for causing myofascial pain, so pain that arises from muscle or connective tissue, and that can have a slight irritation on the nerve around that. So it's called dry needling because the needles themselves don't actually administer any injection or anything like that. So I've got one here. You might be able to see that. It's a very fine filament needle, and they're actually identical to an acupuncture-based needle. Okay, so that's about where the similarities stop. As you might suggest from the name, trigger point dry needling is a treatment of the trigger point, so the tight parts of muscle tissue, whereas acupuncture looks at inserting a needle into a very specific point anywhere in the body. So we might take a look at now how some dry needling happens for the upper trapezius muscle on the side of the neck, and I'll talk you through that as we go. Okay, so we're just seeing a setup here for a trigger point dry needling technique for the upper trapezius muscle there. So we've got a pinprick now, moving forward into the piston technique as we look to get a twitch out of the muscle fibres for the upper trapezius, which we're now starting to see there. So we'll continue until a lot of those twitches have faded away, and that makes for our effective trigger point dry needling technique. To book your trigger point dry needling appointment with Goulburn Physiotherapy Centre, call us on 4821 5544.